Welcome to Pharmacy Prep, NHA ExCPT Mock Exam 1 for Pharmacy Technician exams. Let's start. What is the correct sequence of pharmacy workflow? A. Pharmacist verification, data entry, prescription filling, and then pharmacist counseling. B. Data entry, prescription filling, pharmacist verification, and pharmacist counseling. C. Prescription filling, data entry, pharmacist counseling, and pharmacist verification. D. Pharmacist counseling, prescription filling, data entry, and pharmacist verification. The correct answer is first step is data entry. When prescription received, entering the data into computer by the pharmacy assistant or pharmacy technician, and then prescription filling by the pharmacy technician. Then comes to the pharmacist verification, and then finally, pharmacist counseling. So the pharmacist counseling is the last step of the proper workflow. Next, which of the following tasks may only be performed by a pharmacist? A. Counting and labeling tablets. B. Final verification of fill prescription. C. Stocking medication on the shelf. And ensuring expiry dates of medication on the shelves. The correct answer is final verification of fill prescription. So final verification of prescription only performed by the pharmacist. Next, a pharmacy technician notices a possible drug interaction while entering a prescription. What should they do? A. Change the prescription. B. Ignore if it is patient used it before. C. Alert the pharmacist immediately. D. Call the prescriber directly. The correct answer is alert the pharmacist immediately. So after a pharmacy technician finds any alert about the drug interaction or drug serious adverse reaction, pharmacy technician must alert the pharmacist about those serious alerts. Next, which law requires pharmacies to protect patient health information? A. Drug Enforcement Agency DEA regulations. B. Health Insurance Portability Accountability Act HIPAA. C. Omnibus Budget Reconciliation Act. D. Food and Drug Administration guidelines. Correct answer is Health Insurance Portability and Accountability Act. In short, HIPAA is required for protecting patient health information. Next, the usual high dose of amoxicillin is 90 milligram per kg per day, TID, which is 3 times a day, to treat middle ear infection. What is the dose for a child weighing 22 pounds? A. 260 milligram per dose. B. 900 milligram per dose. C. 300 milligram per dose. And D. 400 milligram per dose. Correct answer is 300 milligram per dose. So let's see how do we calculate this dose for 300 milligram. So first step is convert pounds to the kilogram, which is conversion factor is 2.2. 22 pounds was given in the question. So divide 22 by 2.2, that gives you body weight in kilograms. That is for this patient 10 kilogram. So here question says 90 milligram per kg. That is 10 kilogram for 90. So that becomes 900 milligrams per day. So daily dose is 900, but answers are given per dose. So patient is taking 3 times a day as per the prescription. So therefore, if you divide 900 milligram 3 times a day, that per dose would be 300 milligram per dose. Next, the Combat Methamphetamine Epidemic Act limit the sale of A. Pseudoephedrine products, B. Codeine cough syrup, C. Steroids, and D. Narcotics? The correct answer is pseudoephedrine products. According to the Combat Methamphetamine Epidemic Act, it limits the sale of pseudoephedrine products. Next, how many grams of hydrocortisone powder is required to prepare 2 ounces of 2.5% hydrocortisone ointment? A. 2.5 grams, B. 2 grams, C. 1.5 grams, D. 5 grams. The correct answer is 1.5 grams. Let's solve how do we get that one. Here the question says how many grams of hydrocortisone powder to prepare 2 ounces of 2.5%. So first convert 1 ounce equals approximately 30 grams. So that means 2 ounces would be 60 grams. So now you have a 60 grams required for this ointment. So to prepare this 60 grams, so first calculate the concentration percentage. The formula for that is grams of the drug divided by 100 grams or products. So here 2.5% of hydrocortisone. That means 2.5 grams in 100 grams. So which is equals, if you do cross multiply, which is equals, always in the cross multiply, point the arrow to the x grams because you need to prepare for 60 grams. Like 100 grams has 2.5 grams. So 60 gram is how much? So point the arrow to the x grams and then 60 gram arrow to this one. If you do cross multiply, you will get 2.5 grams times 60 grams. This is the grams. And then you have 100 grams. So if you do that cross multiply, so it comes to be 1.5 grams. So therefore, the correct answer is 1.5 grams. Next, which organization regulates pharmacy technician scope of practice? A. FDA, B. DEA, C. State Board of Pharmacy, and D. CDC. The correct answer is Board of Pharmacies. State Board of Pharmacies regulate pharmacy technician licensing and their duties in that particular state. Next, which of the following abbreviation or SIG code for before meals? A. AC, B. PC, C. PO, D. HS. The correct answer is AC. AC refers to the before meals. Next, how long must controlled substance record be kept under the federal law? A. 6 months, B. 1 year, C. 2 years, and D. 5 years. The correct answer is 2 years. Under the Federal Narcotic Controlled Substance Act or regulations, which require 2 years of retention of controlled substances records. Next, which best demonstrate cultural sensitivity? A. Speaking louder. B. Using medical jargons. C. Respecting beliefs and preferences of a patient. D. Avoiding cultural questions. Correct answer is respecting belief and preferences of patient is cultural sensitivity. Next, before releasing a prescription, a technician should always A. Confirm pharmacist completed final verification. B. Recheck prescription themselves. C. Call the prescriber. D. Ask patient to confirm. Correct answer is confirm pharmacist completed final verification. Only pharmacists perform final checks, so therefore pharmacy technician should confirm if final verification is performed. Next, order to administer 1 liter of normal saline to be infused over 10 hours. How many milliliters will be infused 1 hour, every hour? A. 1 ml per hour. B. 10 milliliters per hour. C. 100 milliliters per hour. D. 1000 mils per hour. The correct answer is 100 milliliters per hour. So let's see how do we get those 100 milliliters per hour for this question. Here the question says 1 liter of normal saline to be administered over 10 hours. So the formula have to be memorized. The formula for flow rate is volume of IV divided by time to infuse. So according to this formula, if you convert here, volume is 1 liter. 1 liter equals 1000 milliliters. So 1000 milliliters and time to infuse is 10 hours given in the question. So if you divide this 1000 by 10, so that would be 100 mils per hour. That's your answer. Next, when receiving a wholesale order, first step is to stock items directly, B, verify items match invoice, C, place all drugs in refrigerator, D, give invoice to the pharmacist. Correct answer is verify items match invoice. After receiving any order from the wholesaler, first step is to verify, ensure correct items received. So therefore, you have to match the invoice that is ordered and then received. Which part of the NDC number identifies the drug manufacturer? A, first segment, B, second segment of NDC, and C, third segment of NDC, and D, lot number. Correct answer is first segment of NDC number identify the drug manufacturer. Here is the explanation how it is NDC number verifies. So NDC is a unique 10-digit code used for identifying a drug product. So NDC has three parts. For example, here example of a Prozac 20 milligram 100 tablets bottle. So there are three sections of the NDC. First part is labeler, and then drug, and then package. The labeler first four digits is a manufacturer of the product information, and then drug four digits. Second four digits are specific drug, strength, and dosage form, and the last two digits are amount in the package, which is refers to the 100 means 2. Next, Lantus Solo Star 100 units per ml dispense 3 pens. Each pen contains 3 ml. SIG 30 units subcutaneous every evening. How many days supply last? A, 10 days, B, 20 days, C, 30 days, and D, 25 days. The correct answer is 30 days. Let's solve how do we get those 30 days. So in this one, each pen contain 3 mils and each mil contain 100 units. And so therefore 3 pens are equals to 300 units. So each pen is 300 units, and 3 pens would be 900 units. So patient takes 30 units per day. So the day supply calculation is total units, 900 units divided by 30 units. So if you divide that, that's equals to 30 days. So zeros cancel, and that would be 30 days, 9. So therefore, correct answer is 30 days. Next, a prescription SIG or direction indicates 1 GTT OU QID 10 days. It can be interpreted as A, instill 1 drop in both eyes 4 times a day for 10 days. B, instill 1 drop to the right eye 4 times a day for 10 days. C, instill 1 drop to the affected ear 4 times daily for 10 days. D, instill 1 drop to left 4 times a day for 10 days. Correct answer is instill 1 drop in both eyes 4 times a day for 10 days. Here that explains the answer is instill 1 drop in both eyes 4 times a day for 10 days. So 1 GTS refers to the 1 drop. OU refers to the both eyes. QID is a 4 times daily, and 10 is for 10 days. What is the Latin abbreviation for take 1 tablet 4 times daily after meals and bedtime? A, 1 tablet QID ACPC, 1 tablet QID PC at HS, 2 tablets BID PCHS, and 3 tablet OD ACPC. The correct answer is 1 tablet QID, PC, and HS. So QID is 4 times, PC is after meals, and HS is bedtime. Which medication require refrigeration at 35 to 46 Fahrenheit, which is a fridge temperature? A. Amoxicillin tablets, B. Insulin vial, C. Lisinopril tablets, and D. Aspirin tablets. The correct answer is insulin vials. Insulin vial must be refrigerated in pharmacy. Next, a patient weighs 150 pounds. How many kilograms is this equal to? A. 68 kilogram, B. 70 kilogram, C. 75 kilogram, D. 80 kilogram. The correct answer is 68 kilogram. A patient weighs 150 pounds, so how many? So that means first step is divide by 2.2. 2.2 is a conversion factor to convert from pounds to the kilogram. So weight in pounds here is 150 pounds. So therefore plug in the 150 pounds and divide by 2.2. That gives you 68 kilogram. So here is a note. 1 kilogram is equals 2.2 pounds, or 1 pound equals 2.45 kilogram. That's a conversion factor need to be memorized in order to solve these math questions. Next, an order for trazodone was mistakenly processed as a tramadol. According to ISMP, which of the following practices can help avoid this type of error? A. Dispense less prescription quantities. B. Implement Tallman lettering. C. Reduce use of automated systems. And D. Double count the tablets. The correct answer is implementing Tallman lettering helps to avoid sound like or look alike drugs. LASA drug. LASA drugs stand for look alike and sound alike drugs. To minimize this error, those drugs can be differentiated by using Tallman lettering. Next, what is the day supply of this prescription? Timolol 0.25% solution, 1 GTT OU twice a day for 5 mils bottle. So 5 days, B 10 days, C 20 days, and D 25 days. The correct answer is 25 days. Let's solve how do we get that. So here this 25 days, basically the question is, uh, direction is 1 drop OU, both eyes. That means 2 drops in 2 eyes, and then each day is twice a day. So therefore daily per day, that's a 4 drops. So the standard default 1 mil always have 20 drops. So here 5 mils of this bottle contain 100 drops. So total drops 100 drops divided by per day. That's a day supply formula. Day supply formula is total amount of dispensed divided by the amount of drug used in one day. So here total is 5 mils is equals to 100 drops. So 100 drops total amount dispensed, and each day patient take 4 drops. By doing so, this supply will last for 25 days. Next, methotrexate. Methotrexate for rheumatoid arthritis is typically dosed once daily, B once weekly, C twice daily, and D every month. The correct answer is once weekly. So methotrexate for rheumatoid arthritis, for non-cancer indications or rheumatoid arthritis, always use once a week dosing. Next, which of the following is Schedule 5 drug? Codeine cough syrups, B methadone, C alprazolam, D fentanyl. Correct answer is codeine cough syrup. Low dose codeine cough syrups are scheduled under 5 controlled substances. What is an auxiliary label for metronidazole tablets? A. Take an empty stomach. B. Avoid alcohol intake. C. Avoid smoking. D. Take with plenty of water. The correct answer is avoid alcohol intake, auxiliary label for methotrexate. Because metronidazole and alcohol combination together can result into disulfiram-like reaction. Next, federal law requires a complete inventory control substance every month, annually, every 2 years, and every 5 years? The correct answer is every 2 years. So, federal law requires complete inventory biannual, that means every 2 years, that is a federal requirement. Next, clarithromycin belongs to which antibiotic class? A. Fluoroquinolone, B. Macrolides, C. Cephalosporins, D. Penicillins. The correct answer is macrolide. Clarithromycin, azithromycin, and erythromycin or belongs to the class of drug known as macrolide class antibiotics. Next, which USP standard provides guideline for safe and handling of hazardous medications? A. USP 797, B. USP 800, C. USP 795, D. USP 701. Correct answer is USP 800. USP 800 set the standard for handling hazardous medications. Next, OSHA primarily regulates pharmacy practices related to controlled substance scheduling, B. Patient counseling requirement, and C. Worker safety and hazardous material handling, and D. Insurance claim submission. The correct answer is OSHA ensures employee safety when hazardous substance are handling requirements. A pharmacy technician discussing patient therapy with caregiver should confirm caregiver authorization before sharing details, provide information freely, decline all requests from caregivers, D. Refer caregiver to insurance. The correct answer is confirm caregiver authorization before sharing details. Because according to HIPAA requirements, patient information confidentiality is essential. Next, which drug class reduces stomach acid by blocking H2 receptor antagonist or H2 receptors? A. Proton pump inhibitors, B. Antihistamines, C. H2 receptor antagonist, D. Beta blockers. The correct answer is H2 receptor antagonists block the H2 receptor and that reduces the stomach acid. They are known as H2 receptor antagonist. Next, which dosage form is designed to dissolve between cheek and gum? A. Sublingual tablets, B. Buccal tablets, C. Transdermal patch, D. Suppository. Correct answer is buccal tablet. Buccal tablets are dissolved between the cheek and gums. Next, which prescription medication is indicated for high cholesterol? A. Atorvastatin, B. Albuterol, C. Sertraline, D. Metformin. Correct answer is atorvastatin. Next, atorvastatin is a statin class of drug that are used for cholesterol treatment. Next, which OTC medication is used as an analgesic and antipyretic? A. Acetaminophen, B. Omeprazole, C. Loratadine, D. Pseudoephedrine. Correct answer is acetaminophen. Acetaminophen relieves the pain and also used for fever. Therefore, that is known as antipyretics. And also for pain, that is called analgesics. For fever, antipyretics, and for pain, it is analgesic. Which OTC drug is antihistamine used for seasonal allergies, which is such as allergic rhinitis? A. Brufen, B. Loratadine, C. Omeprazole, D. Diphenhydramine. Correct answer is loratadine. Loratadine is H2 antagonist, which is called non-drowsy antihistamine that is commonly used for allergic rhinitis or seasonal allergies. Next, a pharmacy technician should alert pharmacists if patient prescribe both A. Amlodipine and aspirin, B. Warfarin and Brufen, C. Acetaminophen and Brufen, D. Lisinopril and hydrochlorothiazide. Correct answer is warfarin and Brufen. Warfarin and Brufen, these two drugs, such as warfarin is anticoagulants and Brufen is NSAIDs, both of them increase the risk of bleeding because of their drug and drug interactions. Next, What is the main adverse effect associated with the use of ACE inhibitors like lisinopril? Headache, B. Low blood pressure, C. Cough, D. Angioedema. Correct answer is cough. Dry cough is a major side effect of ACE inhibitors, which is an angiotensin converting enzyme inhibitors such as lisinopril. Next, an inhaler device is most commonly used for which medical condition? A. Hypertension, B. Asthma, C. Diabetes, D. Hyperlipidemia or high cholesterol. Correct answer is asthma. Most medication devices, such as inhalers, are used for asthma because those deliver drug directly into the lungs. That is called bronchodilators, such as albuterol, or steroids, that is also used as inhalers. A patient reports drowsiness while taking diphenhydramine, the best described as adverse drug reaction, B. Contraindication, C. Side effect, and D. Drug interaction. Correct answer is side effect. Drowsiness is the main side effect of diphenhydramine. Next, a patient experiences Steven-Johnson syndrome, which is a severe hypersensitive reaction characterized by flu-like symptom followed by painful red purple rash and blisters on the skin and mucous membranes, and which drug reaction is associated with the Steven-Johnson syndrome? A. Lisinopril, B. Carbamazepine, C. Amoxicillin, D. Losartan. The correct answer is carbamazepine. Carbamazepine is an anti-seizure drug, and this is known to have serious allergic reaction that is known as Steven-Johnson syndrome, and which is an adverse drug reaction of carbamazepine. Next, which would be the contraindication for prescribing isotretinoin that is used for acne? A. High blood pressure or hypertension. B. Pregnancy. C. High cholesterol or hyperlipidemia. D. Asthma. Correct answer is pregnancy. Pregnancy is a complete contraindication to the isotretinoin because isotretinoin has a teratogenic side effects which can be very harmful if it is given during pregnancy. Next, which describe physical incompatibility during compounding? A. Change in drug metabolism. B. Formation of precipitate in solution. C. Increased risk of side effects. D. Cross sensitivity reaction. Correct answer is formation of precipitate in solution is a physical incompatibility, generally often seen in total parenteral nutrition. At what age the first dose of MMR vaccine usually given? A. At birth. B. At 6 months. C. 12 to 15 months. D. 5 years. Correct answer is 12 to 15 months. CDC recommend first MMR dose vaccine dose is given 12 to 15 months. Next, which of the following prescription contain dangerous abbreviation? A. Ceftriaxone 1 gram daily 3 days. Warfarin 5 milligram daily QHS. C. Furosemide 40 milligram BID. D. Albuterol 2 puff BID PRN. The correct answer is warfarin 5 milligram. So this trailing zero is a dangerous abbreviation. So to avoid those, do not write trailing zero after 5, just write 5. Trailing zeros or lack of leading zeros both can result into errors in prescription. So therefore, those are known as dangerous abbreviations. Next, which therapeutic equivalence rating in the FDA's Orange Book means equivalent? A. BX, B. AB, C. RX, D. OTC. Correct answer is AB. AB indicates therapeutic equivalence to the brand, which is present in reference called FDA's Orange Book. Next, when calcium and phosphate salts are mixed in IV nutrition, the result may in A. Drug resistance, B. Precipitation, D. Hypoglycemia, C. Loss of potency. The correct answer is precipitation. When calcium phosphate salts are mixed in the IV nutrition, that can result into precipitation. Therefore, they should not be combined at the same time. Next, which action is most effective in preventing wrong patient error in acute care? A. Ask patient room number. B. Verify patient using two identifiers. C. Check patient chart only. D. Rely on wristband color. Correct answer is verify patient using two identifiers to minimize the errors in acute care setting. So two identifiers can be name and date of birth. Next, which of the following drug dispensing error can cause serious harm to the patient? A. Atorvastatin. B. Amoxicillin. C. Novolin, which is the insulin. And D. Metformin. The correct answer is Novolin insulin. Insulin is known as high alert drug, which is often results into error that can cause serious harm to the patient. Next, which dosage form is designed for release in the intestine rather than stomach? A. Immediate release tablets. B. Enteric coated tablets. C. Oral suspension. D. Chewable tablet. Correct answer is enteric coated tablets. Enteric coated tablet dissolve in intestine, not in the stomach, therefore that avoid the stomach irritation side effect. Next, a sublingual route delivers medication A. into the muscles, B. under the tongue, C. through the skin, D. into the rectum. Correct answer is sublingual route delivers medication under the tongue, which is sublinguals are absorbed rapidly through the oral mucosa under the tongue. Perpetual inventory systems are often used for A. OTC medications, B. Schedule II controlled substances, C. Expired drug returns, and prescription refills. Correct answer is Schedule II controlled drug substances. Perpetual inventory is used. Perpetual inventory continuously track the balance of the medications and therefore that required for Schedule II drugs. Next, if a drug manufacturer issues a recall for medication due to contamination, how should affected products be identified? A. By NDC number. B. Patient name. C. Lot number. And D. Purchase record. The correct answer is D. That is lot number. Lot number is used for a drug manufacturer when issues a recall to track the drugs, that is lot number is followed. Next, which of the following has serious drug interaction with isosorbide mononitrate? Brand name is Imadur. A. Warfarin. B. Sildenafil. C. Aspirin. D. Lisinopril. Correct answer is sildenafil. Brand name of sildenafil is Viagra. So sildenafil and nitrates such as isosorbide dinitrate, nitroglycerin should not be used together or concomitantly because they can suddenly drop the blood pressure and can make low blood pressure. Therefore, the drug and drug interaction between these two drugs are very serious and they are not combined. What is the generic name for Trulicity? A. Liraglutide. B. Dulaglutide. C. Semaglutide. D. Canagliflozin. Correct answer is dulaglutide. The dulaglutide brand name is Trulicity. Next, a prescription requires 500 ml of IV fluid to be administered over 5 hours. 4 hours, sorry. How many milliliters per hour should be infused? A. 100 milliliters per hour. B. 125 ml per hour. C. 150 ml per hour. And D. 200 ml per hour. Correct answer is 125 ml per hour. Let's solve how do we get that one. So this can be solved by using flow rate formula. Flow rate formula is volume by time. So here volume is 500 milliliters and time is 4 hours. So 500 by 4 gives you 125 mils per hour. So that's your correct answer. Next, antibiotic brand Augmentin is combination of A. Sulfamethoxazole trimethoprim, In short, SMX-TMP, B. Piperacillin tazobactam, C. Amoxicillin clavulanate, and D. Clindamycin benzyl peroxide. Correct answer is amoxicillin clavulanate. Is a combination is known as brand name is Augmentin. Next, a pharmacy technician alerts pharmacists for a prescription of antibiotic sulfamethoxazole trimethoprim, our brand name is Bactrim, for the patient with a history of A. Penicillin allergy, B. Sulfa allergy, C. Aspirin allergy, and D. Peanut allergy. Correct answer is sulfa allergy. Patient with sulfa allergy should not be given sulfamethoxazole trimethoprim because that can have a cross sensitivity with these drugs. Next, in a prescription, PRN means A. Every day, B. As needed, C. After meals, D. At bedtime. Correct answer is as needed. PRN is means as needed. Next, NSAIDs are primarily used for A. Lowering blood pressure, B. Reducing inflammation and pain, C. Lowering cholesterol, D. Controlling blood sugar. Correct answer is reducing inflammation and pain. NSAIDs are, which is non-steroidal anti-inflammatory drug, as the name tells you. They reduce inflammation, which is redness, swelling, and pain and fever. These are called anti-inflammatory drugs. What is the generic name of Norvasc? A. Amlodipine, B. Atenolol, C. Lisinopril, D. Losartan. Correct answer is amlodipine. Norvasc is a brand name for amlodipine. Next, a pharmacist needs dilute 1 gram of medication to make final concentration 250 milligram per 5 ml. What will be the final volume of the solution? 10 mils, 15 mils, and 20 mils and 25 mils. Correct answer is 20 mils. So let's see how do we solve this question. So basically here current concentration is 250 milligram in 5 mils. So now 1 gram in x mils. So simple cross multiplication. To cross multiply, point the arrows to the x mil and then other arrow to 5 mils. These arrows have to be pointing to the same direction. And then if you do cross multiply, you get 20 mils. That's your correct answers. Next, what size of bottle for eye drops is needed for prescription GTT 2 drops in both eyes, QID for 7 days? A. 6 mils, B. 10 mils, C. 12 mil, and D. 20 mils. Correct answer is 6 milliliters. Let's solve how to do it. So total quantity here is uh, 2 drops in both eyes. Therefore, total is 4 drops. So QID means 4 times. 4 times and for 7 days. So if you multiply all together would be 112 drops. So now 1 mil has 20 drops. So therefore 112 drops divided by 20 drops equals to 5.6 mils. So round up to 6 mils. Next, a physician orders 150 milligrams of drug that is available as 50 milligrams in 2 mils, 2 milliliter. How many milliliters should be administered? So A, 2 mils, B, 4 mils, C, 6 mils, and D, 10 mils. The correct answer is 6 milliliters. Let's see how do we get that one. So basically there is a 50 milligrams of drugs in 2 milliliters. So to get 150 milligram, how many mils? So again, this can be done by cross multiplication. Point the arrows to x mil, and then if you do cross multiply, 150 milligram divided by 50 milligram. So milligram is cancel, 0 is cancel, so it's 5 is 3, so 3 into 2 is 6 mils. So that's your correct answer. Next, a prescription for clonazepam 0.5 milligram, take 2 tablet TAD with dispense quantity of 180 tablet. What is the day supply? A, 15 days, B, 30 days, C, 10 days, and D, 20 days. Correct answer is 30 days. Let's solve how to do this. So here, 3ID and uh, that is a 3 times a day, 2 tablets. So per day would be 6 tablets per day. Total is 180 tablets prescribed. So 180 divided by 6 gives you 30 tablets. That's the correct answer. Next, a patient was prescribed oxycodone 5 milligram tablet with instruction to take 2 tablets every 6 hours as needed for pain. The doctor prescribed 7 days supply. How many tablets should be dispensed? A, 14 tablets, B, 28 tablets, C, 42 tablets, and D, 56 tablets. Correct answer is 56 tablets. Let's solve how to do it. So each every 6 hours, 4 doses per day, right? Take 2 tablets every 6 hours. So therefore, that will be 3 dosages. 6 means 4 dosages per day, and each dose is 2 tablets. So therefore, 4 into 2, 8 tablets. So daily dose is 8 tablets. For 7 days, 7 into 8, that would be 56 tablets. Correct answer is 56 tablets. Next, which of the following preparation may contain sugar? A, cream, B, spirits, C, syrup, and D, ointment. The best answer is syrup. Syrups are made with sugar and water, so therefore they are known to cause sugar. Even though other preparation may contain sugar, but primarily syrups are sugar containing products. Average wholesale price AWP is primarily used for determining the copays, estimating acquisition cost, showing manufacturer profit, D, calculate storage needs. Correct answer is estimating acquisition cost. Like average wholesale price estimates pharmacy medication cost. Next, what type of insulin is considered as a long acting and mimic basal insulin levels? A, regular insulin, B, insulin aspart, C, insulin glargine, D, insulin lispro. Correct answer is insulin glargine. Insulin glargine is a long acting insulin. Next, a pharmacy technician notices that a patient received the wrong strength of prescribed medication. What should the technician do first? A, call the patient to tell them keep the medication. B, notify the pharmacist immediately. C, replace it with correct strength. D, ignore the issue and continue working. Correct answer is notify the pharmacist immediately. If pharmacy technician found medication error, pharmacy technician should always notify the pharmacist immediately. Next, a physician prescribes amoxicillin 400 milligram per 5 ml suspension with instruction to take 10 milliliter BID for 10 days. How many milliliters should be dispensed? A, 100 mils, B, 150 mils, C, 200 mils, D, 300 mils. Correct answer is 200 mils. Let's solve. So here BID twice daily. So each time 10 mils. Twice daily will be 20 mils per day. So for 20 into 10 is 200 mils. Next, what size of syringe should be used to measure 7.5 milliliters accurately? A, 7.5 ml syringe, B, 10 ml syringe, C, 15 ml syringe, D, 20 ml syringe. Correct answer is 10 ml syringe. So whenever you select the syringe volume, you should select the right above the higher syringe volume than what is measured. Like here you're measuring 7.5 mils. So therefore you take the higher like syringes volumes in 1 mil, 3 mil, 5 mils. So if you're measuring 7.5 mils, the closest highest one is 10 mils. Or if you're measuring 15 mils, then you take 20 mil syringe. Next, before compounding a non-sterile medication, what is the minimum amount of time a pharmacy technician should minimum wash their hand? 60 seconds, 30 seconds, 20 seconds, and 10 seconds. Correct answer is 20 seconds. According to the CDC, Center for Disease Control, recommend washing hands for at least 20 seconds. Next, OTIC is the route of administration administered through A. Through the eyes, B. Through the ear, C. By mouth, D. Through inhalation. Correct answer is through the ear. Ear drops, also known as otic drops. Next, how many teaspoonful in one fluid ounce? A. 2 teaspoonful, B. 3 teaspoonful, C. 4 teaspoonful, D. 6 teaspoonful. Correct answer is 6 teaspoonful. So 1 ounce is 30 mils. So if you have a 30 mils of fluid ounce and then 1 teaspoonful is 5 mils. 30 divided by 5 is gives you 6. 6 teaspoonful is present in 1 ounce. Next, here are those examples. 1 teaspoon 5 milliliters, 1 tablespoon 15 milliliter, 1 fluid ounce is 30 milliliters, 1 point is 473 mils, and 1 pound of water is equals to 454 mils. Next, a prednisone 10 milligram tablet dispense quantity sufficient. Direction to POQD 2 times daily, 1 POQD 3 days. How many tablets are dispensed for the above prescription? A. 10 tablets, B. 7 tablets, C. 14 tablets, and D. 20 tablets. Correct answer is 7 tablets. So here, how do we get it? First 2 days, 2 tablets daily for 2 days. So that means 2 plus 2, and then 1 tablet for 3 days. So if you add first 2 days and then next 3 days together, 7 tablets. A recall, one recall means unlikely to cause harm, temporary reversible effect, serious health problem, or death, minor labeling error. Correct answer is serious health problem can occur with the type recall. Type 1 recall is the most serious and urgent recall. Next, what type of container is recommended for storing medication that are sensitive to air exposure? A. Blister packs, B. Airtight container, C. Plastic bottles, D. Amber color bottles. Correct answer is airtight containers. Airtight containers are used for drugs that are sensitive to the air exposure. Next, how long is amoxicillin suspension stable after reconstitution? A. Stable 14 days if refrigerated. Stable for 14 days at room temperature. Stable for 10 days if refrigerated. Stable for 7 days if refrigerated. Correct answer is amoxicillin suspension is stable for 14 days if it is refrigerated. Next, these are the examples of storage conditions for suspension, such as amoxicillin, whereas azithromycin, clarithromycin, clindamycin are stored at room temperature, including sulfamethoxazole, trimethoprim, and also ciprofloxacin. All of them are stored at room temperature. However, amoxicillin can store for 7 days at room temperature, but more than 7 days required to refrigerate. Next, according to USP, what is the general rule for beyond use date or do not use after aqueous oral liquids? Do not use after 14 days. B. Do not use after 6 months. C. Do not use after 30 days. D. Do not use after 3 months. The correct answer is 14 days. So, do not use after 14 days. Most water containing reconstituted product or compounded product can stay up to 14 days after reconstitution. That is known as beyond use date. Whereas ointment, the non-aqueous, can stay up to 6 months. Whereas aqueous containing topical cream or maximum 30 days. Next, the expiration date for the drug on the manufacturer label is 04/2026. What day of the month this medication expired? The first day of the month, the last day of the month, middle of the month, and last day of the year. Correct answer is last day of the month. So with this information, this NHA and ExCPT mock exams I'm confident this is very helpful in your exam preparation. Stay tuned and subscribe for more mock exams on NHA CPT and also Pharmacy Technician Certification Board exam or Pharmacy Technician Certification exam. Until then, stay tuned. Thank you.